Type 1 diabetes or juvenile diabetes, a chronic condition in which the pancreas produces little or no insulin. Type 1 was once known as a juvenile diabetes or insulin. Dependent insulin is a human needed to allow sugar glucose to enter cells to produce energy. Diagnosis test for type 1. Diagnosis involves blood tests to measure the glucose level in the body. Glycated hemoglobin test provides the average blood sugar level of the past 2 or 3 months. Fasting blood sugar (FBS), usually performed after overnight fasting, resulting of the test can confirm diabetes based on the level of glucose in the blood. Random blood sugar (RBS) performed any time of the day, and it may be repeated and confirm high blood sugar. A common form of diabetes, mellitus, that develops especially in adults and most often in obese individuals that is characterized by hyperglycemia resulting from impaired insulin utilizing couplet with the body's inability to compensate with increased insulin production. Diagnosed test for type 2. Postprandial blood sugar PPBS measures the level of blood glucose after 8 hours of fasting. Oral glucose test measures average blood glucose over 2 to 3 months. Urine test to detect the amount of excess glucose being exerted out of the body. Glycated hemoglobin A1C test. This blood test indicates your average blood sugar level from the past 2 to 3 months. Normal levels are below 5.7% and result between 5.7 and 6.3%. It's considered pre-diabetics. An A1C level of 6.5% or higher on 2 separate tests can mean you have diabetes.
Warning signs for type 1 and type 2. Both types of diabetes have some telltale warning signs. Hunger and fatigue is one of them because your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to take in glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin your body makes, the glucose can't get into them and you have no energy. Peeing more often and being thirstier. Normally your body resorbs glucose as it passes through your kidneys, which diabetes pushes your blood sugar up. Your kidneys may not be able to bring it all back in. This causes the body to make more urine, and that takes fluid, dry mouth, and itchy skin. Because your body is using fluids to make pee, there's less moisture for other things. You could get dehydrated and your mouth may feel dry. Dry skin can make you itchy. Changing fluid levels in your body could make these lenses in your eyes to swell up. They change shape and have trouble focusing. Organs primarily affected for type 1 and type 2. Type 1 and type 2 diabetes can affect major organs in your body, including heart, blood vessels, nerves, eyes, skin, and kidneys. Maintaining a normal blood sugar level can dramatically reduce many complications. Organs secondarily affected by type 1 and type 2. Endocrine, excretory, and digestive systems. If your pancreas produces little or no insulin, or if your body can't use it to alternate hormones or use to turn fat into energy. This can create high levels of toxic chemicals including acids and ketone bodies, which may lead to a condition called diabetic ketoacidosis. This is a serious complication of the disease. Symptoms include extreme thirst, excessive urination, and fatigue. Your breath may have a sweet scent that's caused by the elevated levels of ketone bodies in the blood. High blood pressure levels and excessive ketones in your urine can confirm diabetic ketoacidosis. If you're untreated, this condition can lead to a loss of consciousness or even death. High blood glucose levels can cause gastroparesis, which is hard for your stomach to completely empty. This delay can cause blood glucose levels to rise. As a result, you may also experience nausea, vomiting, bloating, and heartburn. Kidney disease related to diabetic is called diabetic neuropathy. This condition doesn't show symptoms until its later stages. If you have diabetes, your doctor will elevate you for a neuropathy to help prevent irreversible kidney damage or kidney failure. Diabetes raises your risk of developing high blood pressures, which puts further strain on your heart. When you have high blood glucose levels, this can contribute to the formation of fatty deposits in your blood vessel walls. Over time, it can restrict blood flow and increase the risk of atherosclerosis or hardening of the blood vessels.
Controllable risk factors are those which you can take steps to change or influence. Diet, stress, and smoking are controllable risk factors. Uncontrollable risk factors are those which you cannot influence, such as sex, age, family, history, and ethnicity. Some known risk factors for type 1 diabetes include family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. The presence of certain genes indicates an increased risk of developing type 1. Geography. The incidence of type 1 diabetes tends to increase as you travel away from the equator. Age. Although type 1 diabetes can appear at any age, it occurs in children between 4 and 7 and in children between 10 and 14 years old. Risk factors for type 2 diabetes include obesity, high blood pressure, ages 45 or older, low level of HDL, which is good cholesterol, or high level of triglycerides, have depression, NIH external link, have a family history of diabetes, have a history of heart disease or stroke, have polycystic ovary syndrome. If you're an African American, Indian, Hispanic, Latino, or any other ethnicity, you have a higher risk for obtaining a type 2. And if you're not physically active, then you're at higher risk. Treatments for type 1 diabetes. Taking insulin. Anyone who has type 1 diabetes needs lifelong insulin therapy. Types of insulin include short-acting insulin, rapid-acting insulin, intermediate-acting insulin, and long-acting insulin. Injections. You can use a fine needle and a syringe or an insulin pen to inject insulin under your skin. Pens look like ink pens that are available in disposable or refillable containers. Insulin pumps. You wear this device, which is about the size of a cell phone, on the outside of your body. A tube connects a reservoir of insulin to a catheter that's inserted under the skins of your abdomen. This type of pump can be in a variety of ways, such as on your waistband, in your pocket, or with specially designed pump belt. Carbohydrates, fat, and protein counting is also a treatment. Frequent blood sugar monitoring, which includes continuous glucoses attached to the body using a fine needle just under the skin that checks blood glucose levels every few minutes. CGM isn't yet considered as accurate as standard blood sugar monitoring, so it's still important to check your blood sugar levels manually. Eating healthy foods, exercising regularly, and maintaining a healthy weight are also treatments for type 1 diabetes. Some treatments for type 2 diabetes includes weight loss, which losing weight can lower your blood sugar levels. Healthy eating, which is an important center for your diet around fewer calories, fewer refined carbohydrates, fewer saturated fats, more vegetables and fruits, and more fiber. Regular exercise, blood sugar monitoring, and medications or insulin therapy. Some medications include MEG, which is a medication that stimulates your pancreas to make more insulin. DPP-4 inhibitors are medications that help reduce blood sugar levels. Metformin is the first medication prescribed for type 2 diabetes. It works by lowering glucose production in the liver and improving your body's sensitivity to insulin so that your body uses more insulin more effectively. Thia is a medication that makes the body tissues more sensitive to insulin. SGLT2 inhibitors are drugs that prevent the kidneys from reabsorbing sugar into the blood. Sulfon is a medication that helps your body secrete more insulin, and GLP-1 receptors agonists are injectable medications that slow digestions and help lower blood sugar levels.
Prognosis with and without treatment. Mean life expectancy amounts to about 70% compared with the whole population. Mean survival after manifestation is more than 18 years. Diabetic coma has almost disappeared as a cause of death. Today, approximately 75% of diabetics die from vascular complications, mainly from coronary heart diseases or conditions caused. A 55-year-old male with type 2 diabetes could expect to live for another 13 to 21 years, while the general expectancy would be for another 24 years. A 75-year-old male with the disease might expect to live for another 4 to 9 years compared with the general expectancy of a man that will live another 10 years. Some interesting facts about diabetes. More than 30 million people in the United States have diabetes, and 1 in 4 of them don't even know they have it. More than 84 million U.S. adults, over a third, have prediabetes, and 90% of them don't even know they have it. Diabetes is the 7th leading cause of death in the United States and may be unreported.
My daddy has a gold tooth. Wow, gold tooth? My dad has a gold tooth. My dad has diabetes. My dad has diabetes.